In Gutika formulations, usually Chandraprabha is a regularly used one. Kaisora or Kanchanara Gugulu or Yogaraja Gugulu I usually use. Churnas in the form of either. Remember always, because that's what I said. It's if you start explaining it, it's very difficult. Remember these rules. Whenever a patient comes with a Nija type of condition, remember Amapachana is the first thing. So always do some Rukshana initially. Then start with the main course of the treatment. That's what the medicine says. So for Rukshana, usually I will go with Ashtavargan Kashaya, Aristas in a higher dosage, Vaishwanara Yogaraja Churna, or sometimes even Hingoshtaka Churna I use. Once the Rukshana part is over, you feel that Amapachana is done, you will go with the main line of treatment. That's the medicines which I said. And finally, for the final part, the Rasayanatva and the Brahmanatva part, we give certain medicines. The ones which I usually use is some Rasayanas or Kritas on a longer term, which I have found to be very effective, especially like Nitya Snehapana. Panchatiktaka Krita is one I regularly use, or Gugulutiktaka Krita, for a long-term basis. And that too, not on a daily basis. I usually advise is asking the patient to see for the snigdhata of the skin and then alter the dosage. Maybe sometimes at weekly once or up to 14-day once. 1 spoon of Krita, I will ask them to continue to maintain the suppleness and the health of the patient. In Thailas, I usually use Murvarna. Murvarna is my choice for any Abhigataja condition that comes in. Extensively I use even after the Abhigata condition is over. Then also sometimes I go with Murvarna only. It's Padavita Samana and gives excellent result in patients I have seen. Only thing is, remember about the irritation part. If it is not in the correct paka, it can cause irritation. Another oil which I use is Bela Taila, sometimes Hanondara Karpuradi mix I use. These are the main Tailas which I usually go with. So this is my way of treating orthopedic cases.